A.B. Shetty Memorial Institute of Dental Sciences in Mangalore. After that, I did my post graduation with Rajiv Gandhi University in oral pathology, and then actually I moved to Dubai. My husband was there in Dubai at that time. Then I gave my DHA, I got my license, and then my husband decided to move to the US. Then I had to follow him. So I landed here in 2019, and then I was applying for my job visa. Actually, when I moved here, I didn't have any plan of doing DDS because, as per our Indian thoughts, we had that thinking that, we have to pay the whole amount as in one bulk as the fees. And I was thinking that I don't have so much money to pay for the DDS. So I was not in the plan of doing DDS actually. But then I came to know from my friends that here we don't usually do that. We take a loan and we pay it in, parts. So that's when I was like, okay, let me try for that. And I decided, okay, let me give INBD. And then if I clear that, then let me go ahead and see the next. So that's when I also have, on the same time, at the same time, I was trying for a dental assisting job. So, but it was in 2020, the COVID hit, and I couldn't start working as a dental assistant. Then I started working only by 2021 May or June, something like that. So, uh, then I gave my NBD in 2021 and applied in 2022 cycle, the March cycle. But in the first cycle, I could get only one invite that was from USC, but I couldn't clear the interview. Maybe I was not meant for PBL kind of interview. I don't know. So in the same cycle, when Colorado opened in October, that's when September, October, that's when I uh, applied to Colorado and I got accepted in 2023, July.
Awesome. That is technically one cycle itself, right? I mean, it,
Yes, but
you applied the next cycle.
yes.
However, yeah, acceptance came from the first cycle itself.
Yeah, the second cycle, I think I got more invites, interview invites. But in the first cycle, I got only from USC and Colorado. But when I
Awesome.
applied the second cycle, Colorado interview was going on. So it was hand
Ah,
in hand.
yes. Hand in hand. That's a little bit, I mean, that's the sad part. You will not know until you apply for the
Yeah.
second time, which they should think about a little. I mean, I hope they do that, but until then, it becomes a bit of an overlap. But meanwhile, you mentioned PBL. So I just wanted to ask, is there any, who all are applying for the first time in this lot? You all can again unmute or show video or raise your hands. Shreya, Nitya, Ishita, everyone else, second KS, Navneet. Okay, all right. So that's, I mean, some of you. And anyone here who does not know what PBL or USC, is. Okay, all right. Krishna Priya, if he's trying to say something, we can't hear you exactly. But meanwhile, Rajalekshmi, do you want to just very briefly tell them about what USC and what PBL, all those very scary, abbreviations mean?
So basically, PBL is a kind of interview. I don't know whether other schools have it, but that's a kind of interview that's followed by USC. I think it's a teaching pattern there where you discuss upon a case and where you will be divided into a group of 8 or 9, and there will be, I think, two faculty. When it comes to interview, it's the interviewers who are sitting, and they'll be looking at you like how you are discussing about a case. Like you should show some upper hand that you're trying to help others, and basically you're working as a team. So it's a kind of teaching pattern what they follow in USC. So they carry out the same thing during their interview, but I unfortunately I couldn't make it. So
What was that experience like? Like, there'll be so many people, right? You'll have to mingle with all of them. And
So basically, I don't think the cases what they gave was very generic. It was not dental related. It was more of a
Okay.
medical related topic. So basically, they are not seeing whether you come up with a diagnosis. They are seeing whether you can work as a team, how you take leadership, how to how to get others speaking, how you give others the opportunity to speak and all that. So yeah, it's a little challenging kind of interview. To be frank, it's not the face to face kind of interview.
Yeah.
So it's like a very different, but yeah,
Mhm.
it's their way of teaching.
Still
So
there.
we should
Yeah.
appreciate it.
She's right. So just for whoever's not aware of it, just keep it in mind. I just thought, it'll be informative for you all. This is the only school I think which has a very like radically different pattern. Every other school, even if they have an MMI, even if they have in person, it's still pretty much the same that you have to sort of follow. And some schools have clinical, of course. But within USC, this is how they do things, like how Rajalekshmi mentioned about PBL. There's a follow-up question on that, which is, do you have to discuss a case with everyone in the group? Yes, right? They'll allot you in a
So
group.
yeah, they'll give you the I think the case. It's basically the history. They'll give you the symptoms and everything, so you kind of you have to read, one person has to read. I actually don't remember so much now, but according to what I remember, it's like you have to, some person has to read the question, point by point, each person has to tell the what are the symptoms and all that. Then you give everyone an opportunity to come up with some kind of diagnosis and all that. So basically everyone has to speak. It was a very good experience, to be frank. Like, I never gave such kind of interviews, so it was very different.
Nice. Dr. Isa, do you have any follow-up question on USC? We'll go to CU. I just, thought we'll take a detour because
Yeah.
USC will be helpful. Anything to ask, Dr. Isa? I'm not sure if I'm pronouncing your name right, but okay, cool. Okay, so we'll move into CU. So we have gathered questions from the group, Rajalakshmi, when we had them
Mhm.
fill the form. So we will move with those questions ahead first, and as we answer them, all of you all on the meet, if there's any questions that pop up in your mind you want to ask her, please text on the chat, and we'll take that up as well. So one common question that we had on the list is about the loans, which is not an application question, but I think
Mhm.
while applying itself, it sort of rattles the mind because there's such a big investment awaiting. So, what is your story like? How did you manage the loans and how your visa, etc.
As like what I remember is like as soon as I got the acceptance, I was over the moon. Like then from the next day, actually the reality hit, and I was thinking about how to pay the loan. So I got a co-signer. Actually, it was my husband's friend. So we applied with Discover. At that time, Discover was the one which gave very good rates. Like, I mean, everybody, almost everybody was applying with Discover because they used to give a very good rate. But we also tried with, I think, Prodigy. I don't remember. It was a private loan, but
Sure.
at that time they were not giving loans to people who are residing in Texas because of some
Oh,
economic issue.
okay.
I'm not sure about it, so we couldn't see that part. Then Discover was the only option, so I applied with Discover. But now I heard that Discover is not giving loan anymore. They tied up with some other bank and they are not giving
All
student
right.
loan.
Okay,
So
okay.
I think people are trying with Sally Mae and all other
Okay.
options. Yeah, but if you have green card
So
and
kind
citizenship, you
of
can do
it
better.
worked out.
Yeah.
It worked out for you better. And do they cover your living expenses as well, or and complete tuition, or how is there like a percentage?
So for me, because I'm here with my husband and kids, I am not looking at the living expenses. So it is only for my tuition.
Makes sense.
And
Okay.
I applied for loan only for the first year. The second year, We
Okay,
are
all
still
right.
trying to figure out. Yeah.
Okay, sounds. And just one last follow-up on the loan, which is when it comes to Colorado, a lot of people, when they apply to a particular school, the question that they have is, how does the school help in loans? So when it comes to CU, do they, indulge in that? Do they at all?
Um, uh, the school does not give us much options for loan. I mean, they don't give you much options about how to apply and all that. It's up to us how to figure out the loans and everything. They helps with federal. I think they help you with the federal loan thing and everything. But
All
apart
right.
from that, the private loan they don't usually
Okay,
help
okay.
us with that.
Got it. All right. Sounds good. Thanks on that. I think loans are the most loans and LORs, and weirdly
Yeah.
enough, when you start
So I have
applying, letters
many
are
people,
scary.
yeah, I have
Yeah,
many people who get loans from India. I'm not sure about the process, but I've heard that many people are getting loan from India. But
correct.
again, in India, the process is a little longer. It doesn't happen as
Uh,
fast as how is
correct.
it in US. So
I remember Dr. Nourah telling us that she applied in India as well and in the US, India being a home country, and then her Indian loan got sanctioned, but by then I think she got the
yeah,
upward done and all of that. And so for anyone who's in India, then that is possible, but then collateral becomes an issue. I think you have such a big
yeah,
and you need to give land or like basic major collateral. For the other countries, I'm not sure how it actually works. Hopefully I'll like get somewhere and tell on that later, but
yeah,
anyhow, so that's about loans. So coming to the other scary L of this entire application
yeah.
process, which is letters of recommendation. So what are your 2 cents on that? In basically about CU, like what did you submit? I know this was a year ago, but I don't think CU's rules have changed primarily. So what
Yeah.
did you? How was that about?
So I've already always heard that the three best combination is one from the dean, one from your faculty back in India, and one from the dentist whom you shadowed or worked with in the US. So that's the best three combo that I've heard. But of course, if you're not able to get an LOR from your dean, you have other choices. And I think there are some schools which require a dean's letter like NYU, I think, yeah. So for them, in such case, you'll have to email them and ask how to go about it. But I submitted Dean, and it was one of my professor back in India, and then I got it from my dentist in the US. So the LOR, as we know, like for CU, it's a little different. Like it's not just submitting your LOR, you have to fill out a form kind of thing where they ask about your strength and weakness. So it's better if you give a heads up to your recommenders, like how to go about the weakness and everything. Um, so and also I think you'll have to fill out how about the professionalism, ethics, and everything. They'll ask you to pick up an option. So just give a heads up to your recommenders that to expect such things in the LOR, so so that they don't get shocked. And I remember I didn't know anything, so my professor, she called. I was in vacation in Arizona or something, and she called me early in the morning asking what should I fill. There are a lot of things in that. So then I told her, you just have to do this. Then she filled it out. So it's better to give them a heads up on what to write. So
That is actually very, very one like great point for everyone listening because this CU's letter is different, and it can actually be quite daunting. Like if some four windows are there, 4 or 5 windows, and you have to
yeah,
keep going through each. So I think I mentioned both of us. Meenakshi, my head coach, is also here. So we had a live on Instagram the other day. So we were talking about how it'll be nice if you all can go and view the letters template, which is on the website itself, CUISP's site. You will be able to go and view it. Just put in some information and keep going through each page. Now, this is not to, this is not to say that you should view everything beforehand, but it really helps you to tell the recommender what to expect because we know that most recommenders are not really pumped up and enthusiastic to
yeah,
give you a letter.
And one more thing
So
is like
yeah.
whatever they have written in our general recommendation letters, all positives. So when they ask about the weakness,
Yes.
that's when they
Yeah.
get stuck and they'll give you a call. Oh, what do I write about the weakness? So that's when they get a little, oh my God, what to do, like that. So it's better to give them an idea of what you are expecting in the recommendation letter. Basically I didn't have any idea that this is the kind of recommendation letter what they had.
That's absolutely right. Weakness is one. And the second thing is they have a grading page. Not sure what you call it. You know, that likely, most likely,
Uh-huh.
recommend, would recommend, not recommend, which is in a way makes it their job easier, but also in a way it's a little bit of like, it's a bit off-putting. You have
Yeah.
so many, like some 10 to 10, 10 to 15 parameters. So not everyone wants to go through each and then keep
Yeah.
grading. So you want to tell them, you know your recommenders well, right, guys? So choose to whether you should email them, give them a heads up. Do you have to pick up the phone and call, or in some cases, I know nothing helps, so you just like hope they do it and you just take the leap of faith. But yeah, any other questions on the letter? And guys, it would really mean a lot more to you as well if you are more engaging. And I would us coaches, this is the thing that we do on all webinars, just push you to come on camera or audio. So I would keep repeating it. Please don't mind me. But if there are any other follow-up questions on letters, y'all can push that in. I think from the questions that we got, they were asking about the ideal recommenders, which she already addressed. And in Colorado specifically, they do say that dean's letter is not mandatory, so you have that option. They just want a letter from the BDS or your dental school, undergraduate school. That being said, we did speak to someone recently who told us that it who told us that while on some review, CU told them that having a dean's letter is like adds value, is good. So if you have a dean's letter, which she's a reapplicant. So I think when she went for review, she was told this. So if you do have a dean's letter which adds value, they've probably taught you as a professor, they're willing to write a personal letter, I would say go for that, aim for that. Otherwise, you can afford to switch it up, but just know that, you know, these are the different parameters. It's not mandatory, but if you do have a chance, you can always send them the dean's letter. All right. So that's about the letters. And moving on to the what the school feels like, Rajalakshmi, like after joining in, what is a lot of what the questions that have come up talk about, will I be selected? So what they mean to say is, you know, some of them are older than the rest of the crowd. Some of them are fresh grads. They've just got out of school. They're still new. Some of them visa as well. They are on a visitor's visa. So what does your class demographic or CU look like? Do you think there's any particular niche they're looking for and you would say you would better not apply? You can save the money there from your experience.
So that's one positive thing I've seen about CU, that we have all kind of people. So starting from fresh graduates to people with 15 years of experience, we have all of them, and we have 40 plus, 25. So it's a varying range. And when it comes to diversity, we do have people from all part of the world. And but as we know, like Indian applicants are more, about I think about you can say 60 to 70% is Indian applicants. So Indian population is little more, but that doesn't mean that they take Indians more. No, it's like it's a mixed population. So it doesn't matter. We have like maybe 30% of our class students have like post graduation. So it doesn't mean that you should have post graduation. Some people have MPH and MBA. So it's like a mixed kind of population. Doesn't matter whether you're a first time applicant, doesn't matter you have applied 5 times. CU takes all kind of people. So it's just your luck. Maybe next time. So if not this time, maybe next time. So there is nothing. I mean, I would not discourage anyone from applying. So because CU doesn't stop you. I mean, if you are a reapplicant, you're most welcome. So I've seen in the past that some schools does not actually encourage people who are actually reapplicants, but we don't have anything like that. So yeah.
Yeah, CU does. You're right. They're very welcoming
Yes,
that way, and they take like 40 people, right, in one intake. Is it around
yes,
40?
it's 40. Yeah.
Mm. So there's a lot of diversity, and this school you can actually see the diversity in terms of like experience and stuff. It's very evident.
Yes.
Um, can you? Is it okay to name like a few nationalities from your like from the school,
So
apart from
we
the
have,
Indian subcontinent, of course?
yes, we have people from Afghanistan, Pakistan, we have from Iraq, Iran, then we have from Venezuela, we have from Sweden. So we have people,
Sweden.
a lot of
Wow,
people. Yes, we have people
nice,
from Canada. So yeah, we do have from Egypt. So
nice.
it's
All
quite a
right,
lot.
okay.
Yeah.
That's always good to hear. And you mentioned reapplicants. So, do you know whether? So, I'm asking you this question because I know that a lot of seminars are also done by webinars and seminars are done by
Yes.
CU. So, in terms of reapplication as a student there, have you heard of what the school is really looking for when someone reapplies? I know there are a couple of reapplicants here, I think, or in the list. So, apart from general profile building, what do you think if you're applying to CU? How can someone really make that mark when they're applying again? Any inputs there?
So I mean, basically they are looking how passionate you are, like whether you are continuously trying to improve your profile, like you are genuinely interested in dentistry. So even during the interviews, that's one thing, at least in my interview, that's what I noticed, that they are checking whether you are genuinely interested, and it's not just for the sake of doing dentistry. So so if you are, I would advise you, if you are a reapplicant, try to build up your profile by attending a lot of CEs. That being said, not just an online CE or something like that. Do some hands-on and try to build up your profile. Do more shadowing, and whatever you can do to show that you are genuinely interested in dentistry would actually help. So other than that, I mean, yeah, then once you get an interview, everything boils down to your performance during the interview and then for the bench.
So let's move on to that because obviously people
Yeah.
have asked about the interview format and what it feels like to walk into like there. And so how was it for you? And do you know if things have changed in the last 1 year?
Yes. So ours was the first batch after COVID to have an in-person bench. So we had around 120 applicants who were selected for the bench. So before that, for the Zoom interview, we had around, I think it was around 240 or something. Then they reduced it to 120 during the bench. So it was very welcoming. That's one thing I liked about CU. I mean, as soon as you go there, you don't feel like you have gone there for an interview. The people are so welcoming. We had a meet and greet session in the morning. So after that, I was kind of calmed down. So I entered there with a lot of stress, but after Dr. Bhaskaran introducing and all that, we were kind of actually calmed down. Then we were divided into batch of three, where we had one batch had student panel, the other batch had school tour, and the other batch had bench interview. Then we altered. So it was like that, but there is a slight change since this year. I was volunteering for this year, so we had only two sessions. One was the student panel, and the other was the bench. So I think maybe because it was too long. So,
Means no
but
school tour, is it?
yeah, there was no school
Okay.
tour. So it was only student panel and the bench. Then, so this time they invited around 140, I guess. I'm not sure about the number, but yeah,
Okay.
it's about that range, 120 to 140 people who usually come for the bench. So it was very nice. They give good food. So food is an attraction. So I like
That's a
food.
highlight for sure.
Yes, they
Okay.
give good food, and the people are so welcoming. Even the ISPs, they were very good. They were very nice, describing about the school and everything. It was very nice, actually, very good experience. And once I was about, I mean, actually, I came with my family for the bench test. We all drove from Texas. So my husband and my kids were there. And so when I was going back, I was passing Colorado University, and I was crying that what if I don't get here? Because, and my son was telling me, it's okay, Amma, next time we'll try again. So it was kind of very emotional when I left CU, and I was like, I want in this college. If I'm not getting it this year, next time I'm trying only for CU. It was like that. So it was very emotional, and
That
then I
means the
decided
school
to
has made such an
yeah,
impact on you when
yes, actually, yeah. I mean, I was in love with CU after my bench.
that's nice. That is really nice. I mean, I'm sure some people have varied experiences, but generally, CU, then Loma Linda, Health, ATHSU, Texas Health University,
UTH. Yeah.
UTHSA, correct. Thank you. All these schools, especially out of the others, we keep hearing people speak very endearingly about the atmosphere and
And
they want to go back.
then 80
I think
still, I
you
think.
80 still UOP also I think sometimes because of how they are very casual interviews. So and yes, as you're right, she does sound inspiring, and which is why she's here, and I'm really glad that she's inspiring you
Yeah.
all as well.
The day I got the
And yeah,
acceptance call, sorry to interrupt,
no, no,
acceptance
go
call,
ahead.
even in the morning, I was talking to my mom and I was telling her, I want this, I want to be in CU. And then after maybe like 2, 3 hours, I called her again, and I said I got into CU. So it was like, yeah, it was like a dream come true. So even after that, my husband was like, let's wait to hear from UTHSA. But inside, I was like, I should not get an invite. Yeah, I was like that.
And did
So,
you get from there?
no, I didn't.
You didn't. Okay, in the second cycle, you're waiting to hear back whether you will. Oh,
Yeah,
that's Texas, and
yes,
is that why? You guys were in Texas.
I in the second cycle, I got a few invites. I got from UPenn, but the UPenn reduced the seats, and there was an issue there. So yeah.
Okay. So, all right, sounds very nice. So, and what was the interview like? Like, was it? It's usually a panel. So, who interviewed you? What was the Zoom interview? What was that like? And what kind of questions? CU does have clinical questions, is what the practice is. They have radiographic interpretation. How was it for you?
So for me, there was radiographic interpretation, but the questions were very generic. So whatever you prepare for the interviews, it's the same. Actually, a big thanks to Preeti. She is the one who prepared me for the interviews. So, the questions usually, I mean, whatever we prepare for the interviews is the same kind. Then how the interview goes depends upon what was your answer and how you can connect with the interviewer. So, it's like they pick up something from your interview and then divert the interview to that way. So it depends on your answers. And one thing what I would like to say is that never be, don't be like this, feel very casual, and it should be just a conversation rather than a person asking you questions and you're replying to their questions. It should not be like that. It should be more like a conversation, and show that you are passionate in dentistry, and that should work. So I had a radiographic interpretation, but it was just, I mean, we didn't have a virtual you know bench exam kind of thing. So the questions, it was not really clinically focused. It was more towards personal and your professional life. Yeah.
That sounds nice. And we will pass it on to Preeti. That I think she'll be
Yeah.
delighted to hear that. And just a bit on that, since we also coach, what I want to tell everyone is what you said is really right. Um, please make it a conversation. And I was just thinking the other day, like more than anything, right? More than the US, more than it being a dental school, there's a certain human psychology at play here that also you should think about as any interviewer. So, like, I've been interviewing as well. I'm just giving you an example to parallel, right? for like internally for Caapid Simplified or wherever I've been working earlier. So this is not even the US, it's not dentistry, it's nothing. But as an interviewer, if you're coming to me and you're not talking about the job or the role like you know what you do, like you're coming for, I would not be impressed. Like that's a very evident no for me, right? So which is, so that human psychology or psyche is common across everywhere. It doesn't matter which country or what a niche it is for. Another thing that I've noticed is that you just have to be really pleasant on a conversation, on an interview call. So when I say, if I'm using the word pleasant, I'm being very careful because I'm not trying to say that you have to be very animated, you have to be very peppy. Not everyone's like that. Some people are very straightforward, they're very composed, and that's fine. You can be yourself, but you want the interviewer to like interviewing you. Like they want to be, talking to you. They want to be there. And that comes through pleasantness. Like be pleasant, be charming in your own way, smile once in a while. All this will really, really make a difference. You guys have no idea how many people they're interviewing, and you do not want them to feel like, ah, this is just another, person. So be pleasant, bring your own stories, and make them want to talk and know about Colorado. Like that is extremely important. If I'm your interviewer and you do not know the basic things about the school and you ask me something very basic, for me, definitely that would be like, why is this person here? And what you guys should remember is there are other 100 people waiting in the room. So it's not like if you're not great, there's not someone else there, right? Your competition is really like wide open. So like just think of it like that. Put yourself in the shoes of the interviewer. I think that will help a lot. If you have the power to make a decision, how would you go about it? Like, the worst case scenario, how would you scan these people? So think about that, and I think that would really help you to put your best out front.
And one more thing,
Yes.
what I would like to
Uh,
add is like we have some questions for them. Like when they ask you, do you have any questions? Please don't say no, I don't. I'm good. So just research about the school, have some questions for them. That shows how much you are interested towards the course. Like rather than, you're just giving an interview and just want to get done with it. So have some questions ready and show your interest.
and curiosity is one thing, and along with that, there's something that our coaches Krupa and Priti always say, which is, I think Krupa mainly, she talks about how for like almost 20 minutes you have been talking, and this person is, I mean, wants to be interested and hooked, but is obviously bored somewhere, and somewhere they're also like, I want to talk about
Yeah.
myself, or I want to talk about the school. And that's again the common human psyche everywhere, right? Like again, coming back to me, even if I am listening to someone for 10-20 minutes, I'm like, okay, I would like to talk about what I want to offer them. I want to talk about what my team is like, and see whether they are a good fit. So that, I remember Krupa says, tap into that. Do we call it ego? We don't. That human, yeah, that exactly. That they also want to talk, and give them a chance to talk, but don't go around asking things like very basic things that's on the website. Don't do that, but cultivate your curiosity. That is extremely important. But
And
yeah,
don't,
that's
I
a
think what
very
he meant is
valid.
don't ask something which is very obvious in their website. So go
Exactly.
read their website and have some questions which is not very obvious in their website. So something like that.
Exactly. Great. So that's the interview. And anything more you want to add about the bench in terms of exercises? I know that it changes sometimes, but
Yeah.
anything like that?
So they will give you the instructions very well. Maybe 2 to 3 weeks before the interview, they'll give you a detailed email of which tooth, what procedure you're doing. You will not be blindfolded for the exam for sure. You know what you're doing, which tooth you're doing. Just practice. So that's the only thing
Awesome.
which, yeah, I mean, yes, I attended bench test preparation. I attended Duggins for 11 days course or something because I didn't get in Stevenson's and Duggins was open at that time. So, but it was very good. I mean, I'm practicing. I had I had an MDS in a non-clinical subject, so I was out of all this for about, I would say, 7 8 years. So I wanted something which is very elaborate. So I joined Duggins. That was for 11 days course. It was well worth it. So that's the only thing which got me into CU, I would say. And practice. Yeah, of course.
Practice
You
is,
should
yeah,
have your
very
own bench
important.
test. Yeah,
Yeah.
and materials and should practice.
All right. So we'll go to two questions here. So one is, I think Meenakshi has already responded for us, and she's the best person to answer that question from our side. But to add on from your end, Rajalakshmi, they're asking, Shreya is asking about suggestions about the CEO personal statement, since they want something tailored for CEO. Any inputs there as to what could work?
So CU, as you all know, it has its own personal statement. So that's about 3,500 characters or something. So if any school, it's not only for CU, if any school gives you an opportunity to write their own SOP, so then you should describe why you're choosing that school. That's what they are looking for. That's only what they are looking for. So of course you should write about your personal experience and where you came from and everything. Your background should be there, but at the same time you should add why you're interested in their school. Do some research and write about why you are interested in their school. And try to what I say, try to avoid all these cliche stories. Write your own story. So these people who are reviewing your SOP might have reviewed thousands of SOPs, so they know if you are writing it or you are asking an AI to write it. So put your own effort into this SOP and give the reason why you want to be in that school. I mean, find some link, right? Maybe research, or it may be the clinical experience or digital industry, whatever it is. But try to show it in your SOP that this is why I want to be in your school. So that's the only thing I want to say. So I think, I mean, even though they say that they don't review the CAAPID SOP, you never know. I mean, they always have an access to it, so they can go back and check. So try to personalize it to see you.
MS, you wanted to say something?
I
Yeah.
actually have a question for Dr. Rajalakshmi. Hi, Dr.
Oh,
Raji.
hi.
Uh, so there is one thing that we've often been asked by applicants
Mm-hmm.
about research opportunities and research background in CU. This is also related to the statement because a lot of them talk about it in the statement. They talk about the research labs. They also talk about the ACTS
Mm-hmm.
program. So, do international dentists also get to conduct research or partake in research during those 2 years? And how involved are they in ACTS?
I can talk about research like you actually get opportunities to participate in research, but it's only the time which limits you from doing that. It's like the 2 years are well packed and you hardly get any time. The first 6 months, it's like really packed. You don't have time to even breathe. It's that packed. So what we should understand is the 4 years course, what the DDS people are doing, we are doing it in 2 years. So you can understand it's like 6 months, it's like 1 year for them. So it's kind of literally packed, and we start seeing patients by around March, April, where we get transitioned to the clinics. Transition clinic is where we treat our student partners, where we start doing our general examinations, cleaning, and everything in our student partners, which is actually fun. And then we transition to the clinic by around May. So then it's more about your patients. Then you'll have your labs. Then you'll have your didactic sections. Then you'll have your exams. So in between, finding time for research is one thing. If you are really interested, you have a lot of opportunities. CU is great for research, but it's about the time. The same goes with ACTS. So DDS people have a fixed time for ACTS. We do not. But again, it's the time which limits us from everything. You get a lot of opportunities, various programs organized by clubs and everything where you can volunteer, but you don't have an actual requirement for that. And also, this the timing is the problem. I mean, you have to complete everything within 2 years, so we are well packed.
Thanks for that ground reality check.
Yeah.
Yeah. So they can, but they may not be able to
Yes,
because
even
somebody
when
is
I got in, I wanted to do research, but it's you cannot think about that because you are so packed with everything. So
Do people stay? I mean, like once you're done with school, does you can go back and do? Is that an option because you know the professors? Is that the kind of
yeah, of
rapport
course.
that you
I
all
mean, the
create?
professors are very good. They can help you with everything, but I don't. I doubt if anybody stay back. I'm not sure about it. But
Makes
yeah,
sense because
they
you
have a
know, of
lot of
course. Next.
opportunities for research. We have research, all this fest and everything, where they showcase all the research, what is happening in the school and everything. But of course, to be a part of it, you need a lot of time.
Lot of time and
Yes,
yeah,
and
commit
if
a
you
lot of
are
time.
somebody who's really interested in it, you can actually do it. But yeah.
Nice. So opportunities are there. And the same thing for community service also, or is that
Yes.
different?
It's the same thing goes. I mean, you have a lot of volunteering opportunities and everything coming up, but it's a time. If you are really interested, you have a lot of opportunities. Yes.
Got it. Okay. So we'll there's a follow-up question that Dr. Vedanti has asked, which is about what you mentioned about the statement. AI is the scariest topic right now. I think a lot
Yeah.
of people are worried about that. So if she's saying, or they are saying, even if we write our own story as the SOP, we can get it rephrased by AI, right? Or is that also very obvious? Do you know whether school scouts like this, where do they check AI? Are you aware of this?
I mean, about the actual SOP review and all, we are not sure about how they check, but you cannot be that sure that they won't check for if an AI because now schools have all kind of resources, so they can what you can do, they can also do, right? So it's better not to go that route. And maybe it's easy. I'm not sure, but maybe it's easy for them to find out whether you have you know actually took help from an AI to write the story. So better, I mean, they would appreciate it if you can write it. Of course, you can check the grammar and all that. We have various apps for that. But it's better to stay away from AI and all that stuff and write your own story. That's what my 10 cents in this. So so that why to take that risk? And they would really appreciate if you write your own story.
That's right. So we'll just add a little bit more on that, which is there's no right answer. Like even Rajashmi was saying, it's like a bit of this and that because we
Yeah.
don't really like no one knows about what each school has a different policy. And more importantly, there's been this very interesting discussion that we have been having internally because of all the applicants we go through. And I also had this discussion with the director of ADEA-CAPID recently,
Hmm.
admissions. And it was very interesting for me to know that this is also something that everyone is still figuring out. So the internal discussion is this, which is even if you write your own story, like right now, just try and go and type something out on your own and then put it on some plagiarism check or AI detection check website. They might still show 70% or 80% or 50% plagiarism detected
Hmm.
while you've written this by yourself. So this risk, inherent risk, is definitely there. So which means even if you write your own story, this might pop up, which means if you use AI, it'll definitely pop up. So even if it's to rephrase your story, so preferably you write your own, like she said. And if it still pops up, it's a risk, but don't worry too much about it because we think the schools will take it with a pinch of salt because it is still an evolving technology. And most of these seminars that, like, so this director was saying that the AI seminars that they also have, every expert comes and says that it's not working yet, it's not good enough yet. So hopefully schools will also pick up on that and not really go down that route, and meanwhile use apps to just do like she said, Grammarly checks and just fine polish your writing, and otherwise just bring your story. So it's better. And even like MS is saying on chat, it's better to write it on your own. Another, once AI writes it for you, it's very difficult to edit it. You will be very,
Mm-hmm.
find it very hard to actually rewrite what AI is written. That is a little difficult, because then you have to be like a very seasoned writer to bring in some very personal flair into it, which needs time and maybe, and also the skill both, right? So that is a little difficult. You could, but there are other ways you can use AI, like I don't know, like gathering your thoughts. Maybe you write down a few things you want AI to summarize it for you, or like create a structure before you start writing. So try to find out how you can use it at base level, or even to research a school. Use it smartly like that, and don't use it for the actual writing. MS, have I missed out something? Do you want to add
No, you've
anything?
succinctly captured it. Bottom line is what AI will remove is your personal tone. And
Ah,
the other thing is, uh, assuming everything falls in place and you get called for the interview, your personal statement and you should not sound too different. And your original CAPID personal statement, your CU personal statement, and your interviewing persona. If these three are going to sound different, then it's not going to be a match. So it's not a positive picture to present. So better stick
That's
to
right.
your resources, even if it is basic. What needs to be presented is your story, why you like CU, and how you fit into CU. Okay. And just refine it using normal English. Nobody's expecting you to come up with an erudite essay. Just a well written essay is enough. I think that's
Yes,
it.
and the same thing applies to even if you're taking help from humans, like you're taking help from your friends, even us, right? When people come to us, we tell them, once we give you the statement, which is already written after a lot of time spent with the person, we still tell them, if you feel like you want to change things and make it sound like you should do it. Should never think that I've spent so much of time with this person, so let me send it as it is. No, because after, there's a certain limit beyond which someone might not be able to mimic your tone, and that is just how it is. It's inevitable. So before you hit that submit button, it's very important to make it sound like you, change those words, change tonality, and make it you as much as possible. All right, so that is about the personal statement. And I think someone else had, yes, so let's move on to experiences. Rajalakshmi, US experience is something that I think scares a lot of people, that the lack of it sometimes. So here KS is asked, if you do not have US experience, are there less chances that your application is considered? I think you sort of answered that somewhere, but if you want to like direct it, give an answer for this.
so, of course, having US experience is very good, but if you don't have it, they don't ding you on that. So they, as every school says, like they see overall profile. It's not just, US experience. If you have done well in your home country, then that should compensate for your US experience. That should not, what I would say is that should not stop you from applying. So nobody would ding you on not having a US experience. So, but if you have it, it's well and good.
Yes, okay, that's right. How much ever you can gather. Uh, If not, yes. And on the along the sides of that, TOEFL and GPA, the basic stuff, right? Like how important is TOEFL and GPA? What is your take on that for Colorado?
So TOEFL, I think Colorado has a limit of 94 or something. Basically, that means that they should accept everything which is above that. But what I would say is always try for 100. It's not because 100 is something great, but I think most of the people they try for 100. So if you are above that level, it's like you can apply to all the schools without any fear. You don't have to choose among the schools, so you can apply to all the schools. So, uh, but that being said, I have, my batchmates who had 99, 97 who got accepted. So it's not something they are not very picky about that. But at the same time, it's better to have a good score. And GPA, I have I don't think Colorado has any stringent requirements on GPA. I think now every schools have that idea that not every country gives a good GPA, and I think they have a better idea of what to expect from different countries. So it can vary, but yeah, I would say those are like the minor factors. They see everything as everything together. So that should be good.
That's And just some reassurance on that front, which is about the GPA. Again, like this conversation was very fresh with the director, which is why it's coming back to me, and I think it'll add value to you all. She also mentioned this about the GPA. She was talking about how all the schools, and they have discussions with the schools, right? So they know that the schools do realize that GPA is very different in every country, like how competitive it is. So like in country like India, even a GPA which is 3.9 or whatever, if there are a lot of 4.0s, which is why even if you have a 3.5 above, it's still good, but you've not really hit the best mark. That works. But some countries, even a 3 or a 2 point something is good enough or is competitive. So they do understand that. And she even said in India itself, different colleges have different competitive scores. So and this came from her like, this is not prompted by me, this came from her herself. So it made me realize that this is a very wide understanding throughout the entire committee. So which means, they're not going to pin all your chances on that. And you should be reassured that just make sure that whatever you do from here on out, you show an improvement. Your graph should just keep going up and not dipping. That will be the best thing to do. All right. Um, yeah, someone has asked about masters in public health. This person has non-dental masters in the US and is wondering how do you really bring that back to the application. So I know you don't have an MPH, but your master's from your home country itself was non-dental. So how did you back that? It was non-dental, right? It was not really clinical, rather, not non-dental, but not clinical. So how did you bring that into your application and sort of tell them that I've not been in the clinic for a while, but I want to come back and I want to learn. How was that done?
So the question itself answers that, like, you should have a reason of why you did that. I mean, it should not be like, okay, I wanted to do something, so I did it. So you should actually have a reason. If you can get that reason, convince them that this was the reason why I chose that MPH or whatever you did in your home country, then that should work. I mean, even I had that fear that I did my MDS in a non-clinical subject, and what if they ask me like, why you want to do clinical dentistry again? So I had a proper reason for that. So I was able to convince my interviewer that this is why I'm choosing clinical dentistry again, then it worked. So basically, if you have a reason, you should be good. So for everyone,
Yes.
that's the case. Like you should not do MPH just for the sake of improving your profile. You should actually have a reason of why you're doing MPH or MBA or whatever. So when I didn't get my interview in the first cycle, I was also very discouraged, and I was planning to do MBA in health administration. So I was behind that for a few months. So it's like once you don't get any interview calls, you'll be wandering here and there about what to do. You'll be desperate to do something to improve your profile. To be frank, I was there. So I was planning to do MBA in health administration. I called few schools there in Texas, and I was sitting down to pay the tuition for the first semester, and then I was like, wait, why am I doing this when I'm not really interested in doing an MBA now? It was more to improve my profile that I was trying to do an MBA. So I was like, I was telling my husband, let's wait, let me see what I can do rather than doing an MBA now. So I stopped there and then I started doing more of volunteering and everything. And that's when I got my Colorado invite. So after that, I didn't think about MBA. So it's basically, if you really want to do it, or do not just for the sake of improving your profile. You don't have to do an MBA or MBH.
That's very wise advice, which is very true. I know it feels to everyone here that how do I make the decision, which is right, but it'll come to you, I guess, like how it came to her while she was about to pay the fee.
Yeah,
But
I was
having
sitting
interest
down
is
with
important.
my credit card to pay, and then I was like, no, I'm not doing this. I cannot waste 3 more years. I mean, just to do an MBA. I mean, which I'm not even interested in. So
Yes. Shreya is asking, there is a supplemental question asking if you know any alumni, current student, or faculty. Is it okay if we don't mention any name, or is it recommended that we know someone?
it's not mandatory that you should know someone there, but it's if you know someone, it's good to give your name. There is no right and wrong in that. So if you know somebody,
Exactly.
then you can give the name. It should not harm you or help you in any way. So that's okay. If you don't know, just leave it blank.
That's right. I think we have gone through mostly all the questions that we have received, or at least like alongside that. And before we wrap up today, is there any question that is going to come from like anyone here apart from the ones that have already asked us questions? Anything more that you want to ask Dr. Rajalakshmi before she leaves this call? And she's a little more further away from your reach.
Mm.
While we wait for any questions, if there are, I just want to like wrap up by saying that thank you, firstly, Rajashmi, a lot of very specific inputs from your end and very experiential inputs, and that is the best thing to give people because there's no right or wrong here, which is the most frustrating thing about CAPID. There's no black and white, which makes it hard, but also I think it makes it easier to hear from more people because you've been there, done that, like how you were emotional after coming out of Colorado, how you almost paid for a master's and then realized it's not for you. All these are things that I think you all should take home. Not to say that you should not do a master's, not to say that you should be emotional coming out of CU. That's not the idea. But to know that this is how your journey will be, and these are the kind of decisions you'll have to make. And there was a question that came in asking, is it late to apply now? I would say no. Colorado is just opened, number one. Number two, there are people who have even applied like 4 5 days before the date and gotten invitations. I know these people. But that being said, obviously apply as early as you can. That's definitely a best practice. Please use the time and do it. Don't I think we see you a lot of people procrastinate, I feel. Because in March, you're like, I need to get this done, and then you do it, you're tired, and then life gets into the way, and then you sort of wait for Colorado. Don't do that. Apply as soon as you can. But if you couldn't, please still apply because CU is, like she said, known to call like every kind of person, even late applicants, they do call. Maybe you will strike a chord with them. And I hope you take away from this experience. And this is also not to say that everything is like, roses and I don't know, peonies or whatever. There are also thorns. I mean, I don't want you all to go back thinking, but she got an invite in the first cycle. She did, yes, but it might not be for you. You might get in the second and third, but everyone's journey is different. But you'll eventually get there. That's the moral of the story. And like Rajalakshmi said, if this is your goal, then stick to it and keep building your profile. Like she got into shadowing, I think, no, community service, right? You said you got into volunteering and then you heard. So keep building your profile until the day you get your loan sanctioned. Prepare, expect the worst, and just keep building your profile, right? And that's what you should do. And also, anything else that you want to know about CU, you can always reach out to us, and we can even route it through to Rajalakshmi. She's always very promptly helped us out whenever we've had a question and helped us understand more about this. So we can always do that for you. Anything you want to say before we wrap up, Rajalakshmi?
So I would just like to thank everybody for bearing me for 1 hour. I hope I helped you. I didn't confuse you more. So yeah, I mean, what I have to say is, if I can make it, everybody can make it. So I had a long gap. Don't worry about your gaps. So life happens. So you may have your kids, your marriage, everything can happen, and they do understand that. Trust the process, it will happen one day. Don't worry about your gaps and keep working on your profile. You will get there one day.
I love that. I love that you said life happens, and that's true. like, I think that is amazing. That's a great departing note. I think all of y'all should take this back, because people call us and say, but like, I have a gap because I had a child. Is that okay? It is absolutely okay. Like, life does happen. No one in Capital is thinking that you should have always had that dream from day one, from the time you were born, from your BDS. No. So that's amazing, Rajalekshmi. Life happens. It's done. Just try to, like, tell your story now and show them you're interested. And with Nitya's last question, we'll wrap up, which is, if we have done a month-long preceptorship, then is it wise to submit an LOR from a professor, dentist of that school?
Um,
Um,
I actually don't know. I mean, the only problem is, in 1 month, how much you know, how much the faculty know you is like, I mean, that could be a question. So, uh, I would suggest person who knows you a little more would be better, because in 1 month, knowing a person completely, how he works and how what is his ethics, would be little difficult. So that's my take on it. I mean, it's not to discourage you or something, but yeah, I mean, if you can find somebody who has a little more experience with you, who can vouch you like for a long time, then that would be a better thing than getting a person who just knows you for 1 month. That holds more value than this. So,
That's right. Knowing you better is always good, and I think there's a lot to do with, like, it's very subjective. So you have to compare your other recommenders, like she said, like, who knows you better. And like, imagine you have a clinical recommendation. That's another thing. If you have a clinical recommendation from the US, I would say maybe go with that, like a person you shadowed or something, because the schools, they do say that they want to know your academic setting and how you're in a school from the professors and from your home country letters, and then they want to know how you are in a clinical setup. So if you do have a shadowing or, like, an assisting letter, that might maybe add more value, because there they'll be able to detect other skill sets in you. But obviously nothing is again black and white. If this is your best option, go for it. Find the person who knows you really well.
and in
All
that,
right.
one more thing is
Ah,
like,
yes.
if you have, some schools, they accept more than 3 LORs. So in that case, maybe you can submit one more. So
That's right. Okay, I think we're good. Thank you
okay,
so
thank you.
much for your time, Rajalakshmi. Really makes me happy. Thanks everyone for joining. Have a good rest of the night and a nice
Thank
weekend.
you.